So good evening and welcome to the 2024 awards ceremony. It is wonderful to gather together in person once again as we honor our esteemed colleagues for their vital contributions to the nursing profession and healthcare. Every 2 years, it is the distinct pleasure of ANA to hold this special ceremony to celebrate the extraordinary achievements of nurses and advocates. These individuals represent the best of our profession and exemplify the power of nursing, which is the theme for this evening. I could go on and on about the power of nurses, and I'm honored and humbled every day to be a part of this profession. But I'd like to play for you all a video that expresses this passion better than I could.
Our health is our wealth. Thus, nurses' power is our ability to make a difference in people's lives through our compassion, caring, trustworthy character, and commitment to safety.
I believe the power of nurses are to genuinely care, to be compassionate, to advocate, and to be fearless change agents to bring forth a healthier community and a better future. So I think nurses are pretty powerful.
The power of nursing is the opportunity to make an impact on the lives of others and to use their expertise to make a meaningful difference in the world.
To me, the power of nurses lies in compassionately caring for the most vulnerable, treating our patients with dignity and respect as we partner with them through their health journeys.
The power of nurses is their strength and resilience and their ability to provide hope, even in challenging times.
The power of nursing is inspiring grassroots nurses to step up and believe that we can make a difference.
The power of nursing means to me that nurses are the healers of the world, and that's what we've been doing throughout the generations, and that's what we will continue to do. And because we care for and work with patients, families, individuals, communities, nations, it means that we make a difference in the lives of people. We accompany them through their journey of life. We are so important to the well-being of the world. That means we have to use our power to be good to ourselves also and our own well-being.
We have an exciting evening ahead of us, and I know you're all eager to get started. I know I am. So we'll begin tonight's ceremony with the presentation of the ANA President's Award. These awards are conferred to publicly prominent individuals or a group of individuals by the ANA President and the ANA Board of Directors. Our awardees have significantly contributed to the advancement of ANA's strategic activities on behalf of nurses and the nursing profession. They have positively influenced the public perception, attitude, and awareness of the value of nurses and the nursing profession, and have demonstrated a record of strong support for the mission and goals of the American Nurses Association. Tonight's first President's Award recipient is Dr. Rhonda Anderson.
Rhonda Anderson, ANA President's Award. Known for her visionary leadership and dedication to patient care, Dr. Rhonda Anderson has spent her career guiding the nursing profession to a higher level. An Arizona Nurses Association member, Dr. Anderson has served as CEO, COO, and CNO at a number of healthcare facilities around the country. A lifelong volunteer, she has brought her considerable expertise to organizations including the Joint Commission, the American Hospital Association Board of Trustees, the Children's Hospital Association, and the Arizona Nurses Association Foundation. Dr. Anderson's impact is deeply felt on the American Nurses Credentialing Center Board of Directors, of which she's immediate past president. With her oversight, the number of Magnet-recognized organizations and Pathway to Excellence organizations grew significantly. Magnet and Pathway facilities are now recognized in 12 countries outside of the U.S. There are now more than 300,000 nurses certified by ANCC, a new milestone for the certification program. Dr. Anderson guided ANCC through the COVID-19 pandemic, helping the organization pivot to offer flexible options. The changes made continue to strengthen ANCC's programs across the board, especially the Nursing Continuing Professional Development Accreditation. During her tenure, ANCC became the only nursing credentialing organization to achieve ISO 9001 2015 certification. It is with great appreciation that ANA presents Dr. Anderson with the President's Award.
Thank you, and thank you. We really appreciate this. I just want to say what a privilege it has been to be a nurse. And one of my challenges over the years has been working with nurses who are in CEO positions who don't use RN after their name. So I have a mission that before I die, every nurse that's in those positions, COO, CEO, will use RN after their name. It's amazing to me when I did interviews of some of them who do not use that, and I've said, why? And they say, it's not in my job description. And what I say is, A, would there be any MD that's in that CEO role that wouldn't use MD? But second of all, and probably most important, we're the most trusted profession. Wouldn't every person in your communities, if they knew a nurse was in one of those top positions and they saw RN after their name, want to go to your organization? So join me in this initiative. Thank you so much.
Our second President's Award recipient this evening is Dr. Pamela Cypriano.
Pamela Cypriano, ANA President's Award. ANA applauds Dr. Pamela Cypriano for her unwavering commitment to the nursing profession. Her representation of nurses on a national scale and current global advocacy ensures that the voices of all nurses are heard. Currently, Dr. Cypriano is president of the International Council of Nurses and professor at the University of Virginia School of Nursing. With over 40 years of experience as a globally recognized nurse leader, strategist, executive, and advocate, Dr. Cypriano was named one of the top 100 most influential people in healthcare by Modern Healthcare for 4 years running. Dr. Cypriano leads national and international efforts to increase nurse representation in healthcare policy decisions, boost nurses' social impact, and protect the health, safety, and well-being of the nursing community. Between 2014 and 2018, Dr. Cypriano served 2 terms as president of the American Nurses Association, raising the visibility and influence of nurses in addressing national issues. She led nursing's response to the Ebola crisis in the U.S. and vigorously advocated for the right of every American to receive essential health benefits. As president, she engaged nurses and the public to elevate understanding of the critical role of nurses as a force for health. Dr. Cypriano was the founding editor-in-chief of American Nurse Journal for 8 years and continues to publish regularly on nursing issues to raise awareness of issues in nursing. She has been described as leader among leaders, who makes everyone around her feel comfortable, heard, and appreciated. Last October, the American Academy of Nursing recognized Dr. Cypriano with its highest honor as a living legend. For her remarkable and enduring contributions, ANA is pleased to present Dr. Cypriano with the ANA President's Award.
I'd like to thank President Mensa Kennedy and the board for this incredible honor. I know many of you know I've grown up in ANA, starting as the NSNA president, who was actually a committee member on many ANA activities at the time. It was a different relationship, but that's where I cut my teeth in terms of nursing activity, political activism, being able to speak up about practice and all of the aspects that ANA has led for decades. And so I have a very special place in my heart for ANA and always will. And what I learned during my terms as ANA president, I have been able to parlay into now global leadership, which has been a really phenomenal experience. And you may or may not know it, but I can tell you, everyone around the world looks up to all nurses look up to the American Nurses Association and the work of nurses in the United States as the gold standard. And we have that work that demonstrates the impact, and we have ANA to thank for a lot of that, those accolades and the accomplishments and the standards and the research and the credentialing and all of the things that ANA stands for. We are leaders in the world, and again, I credit ANA and all the incredible work that all of you do as well in giving us that stature globally, because it's a really important place for us. I also realize that many of us are so fortunate that we are able to enjoy practice in a world that has so many challenges and problems. And even though we complain we don't have enough staff, we complain that our work environment doesn't always look out for our well-being, I clearly can share with you that we are 1,000,000 times better off than many of our colleagues who work in poverty conditions, in war and crisis conditions, and who have to maintain hope every day in very, very challenging circumstances. So I appreciate all that ANA has given me throughout my career. Part of my job has always been to give back through that service. And so this is an incredible honor that I take as just affirmation that I've done some good things, maybe, in order to be a good citizen of ANA, to work with all of my colleagues, to work with all of you. And I continue to want to serve and do all that I can to elevate that voice and role and visibility and influence of nursing, not only in the United States, but around the world. So thank you very much.
And our final President's Awards recipients to be recognized this evening are the members of the Congressional Nursing Caucus. Their allyship on Capitol Hill is paramount to the recognition of the tremendous value of nursing, helping to advance the profession and address some of nurses' most pressing concerns through meaningful action. The Congressional Nursing Caucus is made up of over 40 bipartisan members of Congress from all over the country who recognize the invaluable role that nurses will continue to play to ensure that Americans have safe access and quality health care. ANA is grateful for their support, leadership, and partnership in advancing the nursing profession at the congressional level. Earlier today, select members of the caucus received their presidential awards during the annual Hill Day. We had prepared a video, though, to honor their contributions this evening.
The President's Award to Congressional Nursing Caucus leaders. The American Nurses Association commends the leaders of the Congressional Nursing Caucus for their steadfast championing of nurses and the nursing profession. Their consistent allyship of nurses and our patients extends beyond addressing the most pressing concerns of the nursing profession, such as solving the nursing shortage, bolstering the workforce pipeline, and providing nurses with the resources and tools they need to thrive, while serving the millions of patients who rely upon them. Their enduring support also demonstrates their understanding of the vital importance of nursing to the U.S. healthcare system. In engaging more than 60 colleagues on a bipartisan basis to join the Congressional Nursing Caucus, these leaders are impacting the profession and healthcare for generations to come.
And for those who don't know, Representative Keegans and Representative Underwood are both nurses. So we're thankful. So a final round of applause for all of our President's Awards recipients. So now, joining me on stage to present the 2024 National Awards recipients is none other than Dr. Kalia Fisher-Grace, Chair of the ANA Committee on Honorary Awards.
Thank you, President Mensick Kennedy. Good evening. There we go. It's wonderful to see so many colleagues, family, and friends here to celebrate these outstanding nursing leaders and advocates. It is my distinct pleasure to serve as chair of the Committee on Honorary Awards. The committee and its subcommittee are appointed by the ANA Board of Directors and are charged with reviewing the award nominations. The committee submits its recommendations for award recipients to the board for consideration. The ANA Board of Directors is responsible for conferring all national awards. So before we begin the national award presentations, I would like to recognize the members of the Committee on Honorary Awards and ask them to please stand as I call their names. Amanda Oliver, ANA Board of Directors. Jacob Garcia, ANA Board of Directors. Patricia Messmer, Florida Nurses Association. Sally Morgan, ANA Ohio. And Abby Horton, Alabama State Nurses Association. Next, I would like to recognize members of the Committee on Honorary Awards Subcommittee. If any members are in the audience, please stand. Again, Abby Horton, Alabama State Nurses Association. Jennifer Perry, North Carolina Nurses Association. Rosa Potts, Washington State Nurses Association. Karen Rawls, Georgia Nurses Association. And Patricia Richardson, North Carolina Nurses Association. For over 100 years, ANA has presented awards to recognize outstanding contributions to nurses in the field of nursing and their influence on healthcare. Tonight, we will recognize 15 extraordinary nurses and nurse advocates for their continuous commitment and dedication to the nursing profession in the following categories: nurse exemplars, nurse champions, distinguished practice in nursing, and nurse pioneers. We will begin the presentation of ANA's national awards with the awards for nurse exemplars category, promoting and underscoring ANA's continuing dedication to the principles of nursing ethics and the highest standard of nursing practice. The ANA Hall of Fame Award pays special tribute to individuals for their extraordinary contributions to the nursing profession over a sustained period through distinguished service, steadfast leadership, exceptional mentorship, effective advocacy, and innovative efforts that have had an enduring impact on the health and social or political history of the United States. It gives me great pleasure to recognize the 2024 ANA Hall of Fame awardee and past ANA President, Dr. Beverly Malone.
Past ANA President Beverly Malone, the Hall of Fame. Dr. Beverly Malone is known as a visionary healthcare leader, accomplished innovator, and nursing champion. Currently, Dr. Malone serves as CEO of the National League for Nursing. Under Dr. Malone's leadership, NLN has advanced the science of nursing education by enhancing stakeholder collaboration, increasing diversity in nursing scholarship, and championing evidence-based practice. Additionally, Dr. Malone serves as Vice Chair at the Institute for Healthcare Improvement Board of Directors. In previous leadership roles, Dr. Malone served as the General Secretary of the Royal College of Nursing, 2 terms as ANA President starting in 1996, and as Deputy Assistant Secretary for Health in the U.S. Department of Health and Human Services. Among many accolades, Modern Healthcare has honored Dr. Malone by naming her to the 2023 list of the top 50 most influential clinical executives in healthcare. Her outstanding contributions to the American Nurses Association are many. In the association's 100th anniversary year, Dr. Malone was elected as the second African American nurse to hold the office of president. During her tenure, she represented ANA on issues affecting the nation's healthcare and the professional requirements of a diverse nursing workforce to ensure the provision of safe, quality care. She traveled throughout the U.S. and internationally to represent ANA at various meetings and conferences, bringing the voice for nursing to decision-making tables. In 2022, ANA honored Dr. Malone with the prestigious President's Award for her strong contribution to the development of ANA's Racial Reckoning Statement. In conjunction with efforts undertaken by the National Commission to Address Racism in Nursing, Dr. Malone's perspectives as both a past ANA president and as a leader in health equity shaped the statement to focus on accountability, while also reflecting on the need for healing. Because of her contributions, nursing is moving toward becoming a more inclusive and equitable profession. In 2020, the American Academy of Nursing conferred Dr. Malone with their highest nursing honor, Living Legend. Time and again, Dr. Malone has proven to be a dynamic, transformational leader who has embraced challenges and advanced the nursing profession. ANA is thrilled to induct Dr. Beverly Malone into the Hall of Fame.
Colleagues, my thank you for this honor to the board, to the president who stands to my left, my sincere appreciation. To my colleagues that sat at my table, I'm just honored to be among you. Pam Cypriano, is just extraordinary, has always been that way. So I could stand up here and talk about all of them, and I know I'm not supposed to do that. So I will try to focus my comments. I wanted to say that I think I'm touching greatness. And the only way for greatness to happen is if it touches you. Others touch you. That's the greatness. It doesn't come just from your insides. I mean, you know the physiological, anatomical kind of, it's not that. It's something about other people deciding that they're going to touch you. And so I want to talk to you a little bit, and I'm not going to spend a lot of time. They told me I didn't have a lot of time. But I want to talk to you about the people who have touched me. And I want to start with my mom and my dad, Frank Malone and Dorothy. They touched me. My great-grandmother, who was a bootlegger in Kentucky. Oh, I'm sorry, Kentucky, I forgot to tell you that. And who raised me and was a healer in the community and had a third-grade education but wanted me to be a nurse with a degree. Who touched me in terms of Hildegard Peplau, psychiatric nurse, Phenom, and the chair of my department when I went to Rutgers. Who touched me, Dr. Hattie Besant, who was a warrior, no doubt about it. The woman was a warrior. I think she wore a uniform. And she touched me by, first of all, accepting me into my doctoral program, paying for it. ANA did. It was the ANA Ethnic Minority Fellowship Program that is still in existence today. And although I got my PhD in clinical psychology, they were kind enough to let me have to be a part of nursing. So I'm getting a degree in clinical psychology, but I'm a nurse. There you go. Touched me. That's greatness touching your colleagues. And then it was Senator Inouye from Hawaii and Pat DeLeon, who was his chief of staff, who said, maybe there's something to this nurse. And on, the touch of others has just been incredibly important to me. I want to say that in the audience, there's Dr. Janice Brewington, who nominated me for this role and who has touched me with her own greatness. She's another living legend. After you hang out with living legends for a while, you just kind of become one. So That's how it happens. So, in order to be kind and wrap up this commentary that I have, I want to thank my family. I have 2 children, Tosha and Jaylani. Tosha's got 2 children, and she has a husband, it helps. And she has 2 children, that's Cammie Malone Winger, and her brother is KJ. And then my son, who was a delinquent for quite some time, he didn't give me enough grandchildren fast enough. He assured me that he could do that at any time and marriage was not required. But I rested my case and said, I'll wait. So now he's married and I have 3 grandchildren, and it's Malone is the first one. And the second one is Ella Bella, which means beautiful. And the third is Izzy Busy, and she is Isabel Busy. They are my inspiration. They are the light of my life, and the most important thing I've ever done. It's the greatness touching me, not me being great. I am great, but only because I've been touched by greatness. That's how it happens. You're great, but it's not just yours. It belongs to others who share it with you. So, what do I want to tell you guys as I step off the stage? First of all, I can be delayed but not defeated. Just know that. You can have a delay in your life. There's nothing wrong with a delay, but it doesn't mean you're defeated. As long as you have breath, you have opportunity. It's a cinch by the inch, and it's hard by the yard. So inch your way along and celebrate all along the way. Don't wait till you're finished to start celebrating. You may be dead. It's called a funeral. The last one is you're either going into a storm or you're coming out of one. So enjoy the space in between. And that has a lot to do with family and loved ones. And so I encourage each of you, there's greatness there. It just has to touch you. Your greatness is evident. It doesn't just belong to one person. Nursing is great. It belongs to all of us. It's a privilege to be a nurse. It's a privilege to be part of the American Nurses Association. I am so very grateful, and God has been very kind to me. Thank you.
Thank you, Dr. Malone, for joining us this evening to join our Hall of Fame. Continue our ceremony with awards for nursing champions. The Award for Nurse Champions recognizes outstanding accomplishments in advocacy for the nursing profession, as well as for ANA. Awards in this category include the Advocacy Award, inspired by Barbara Tolman Curtis, Hildegard Peplau, and Shirley Titus. This award recognizes individual nurses who embrace the role of advocate as a part of their professional identity. We will honor 2 nurses this evening. Our first awardee is Dr. Anielle Burks.
Anielle Burks, the Advocacy Award. Dr. Anielle Burks, Executive Director of the Louisiana State Nurses Association, is a devoted advocate for nurses, patients, and communities. While serving as Health Policy and Advocacy Director, she led the LSNA's legislative agenda. One of her most notable contributions was spearheading passage of Louisiana's first workplace violence law in 2022. This legislation directly impacted more than 3,200 facilities regulated by the Louisiana Department of Health and has guided nurses in other states in passing similar legislation. Dr. Burks also led initiatives to make Louisiana the 12th state to enact surgical smoke evacuation legislation. She role models leadership and service on various governmental boards, committees, and task forces focused on the healthcare workforce. Dr. Burks empowers frontline RNs by teaching health policy at Louisiana State University and presenting at conferences. She is launching the first LSNA Health Policy Fellowship in 2024. For these great strides and more, Dr. Burks exemplifies the role of advocate and is highly deserving of ANA's Advocacy Award.
our second awardee is Jelani DeCastro.
Jelani DeCastro, the Advocacy Award. As a nursing supervisor during the COVID-19 pandemic, Jelani DeCastro saw how PPE shortages impacted nurses' safety and stress levels. Inspired to be a strong voice for her team, she took steps to broaden her role as a nurse leader and advocate. A graduate of the ANA Advocacy Institute Fellowship Program, Jelani was the driving force behind the inaugural California Oncology Nursing Society Advocacy Days event in 2023. She serves as Legislative Director with American Nurses Association California and as Government Liaison with the Greater Los Angeles chapter of the Oncology Nursing Society, a testament to her commitment to advocacy and professional development. Currently Interim Senior Nursing Director at Los Angeles Cancer Care Center, City of Hope, a Magnet-recognized facility, Jelani promotes culturally competent care and encourages a safe environment for staff. For her commitment to empowering all nurses to raise their voice in support of the profession, ANA is pleased to honor Jelani DeCastro with the ANA Advocacy Award.
Next, the Champion of Nursing Award recognizes the contributions of an extraordinary leader or organization who is not a member of the nursing profession. This award goes to Dr. Daniel Other.
Dr. Daniel Other, the Champion of Nursing Award. For nearly 2 decades, Dr. Daniel Other has partnered with nurses to bridge nursing and engineering to solve complex societal and environmental challenges. His innovative humanitarian efforts in collaboration with nurses and engineers have made an impact through improved access to clean water, nutritious food, and energy efficiency in developing communities. A professor of environmental health engineering, Dr. Other champions nurses as innovators in technology and uses his visibility in the engineering profession to call for greater recognition of the work of nurses. He has advanced the nursing profession by contributing articles of significance to national and international nursing journals and by promoting policies that support nursing. Dr. Other's dedicated service to nursing organizations has been recognized with lifetime inductions as honorary fellows in Sigma and the American Academy of Nursing. Dr. Other has devoted much of his career to the improvement of nursing education, preparing nurses to meet the challenges of planetary health care. For his extraordinary commitment, he is being honored as a true champion of nursing.
Our next category, Awards for Distinguished Practice in Nursing, recognizes excellence in nursing research, education, or practice, and outstanding professional contributions of an ANA member in the areas of research, education, clinical care, direct patient care, or public health. The Distinguished Direct Patient Care Award, inspired by Mary Ellen Patton, recognizes an individual nurse who provides exemplary direct patient care and contributes to the advancement of nursing practice by demonstrating a commitment to personal leadership development and by serving as an inspirational role model for others. We are excited to honor 4 individuals with this award this evening. Our first awardee is Jericho Alicante.
Jericho G. Alicante, the Distinguished Direct Patient Care Award. As a clinical nurse too at Cedars-Sinai Medical Center in Los Angeles, Jericho Alicante has spearheaded efforts as an individual nurse and as a committee member to positively impact outcomes involving heart failure education and readmission prevention, hospital-acquired pressure injuries, fall prevention, and central line bloodstream infections. In these vital patient health and safety measures and others, He has ensured rigorous attention to protocols and educated patients and colleagues on appropriate practices and procedures, tangibly elevating the quality of patient care. Jericho has also wielded his energy and insights to transform Cedars-Sinai's new graduate RN residency mentoring program. He not only collaborated with other seasoned professionals to share their experiences and case studies, but also individually mentored new graduates, instilling confidence and enabling these new nurses to thrive. As these nurses grew in their roles, they began to mentor newer nurses, using the same techniques and approaches they had learned, benefiting successive waves of graduate nurses. With his meticulous attention to detail and dedication to excellence, Jericho has significantly improved care quality and inspired generations of nurses.
Tonight's second awardee is Leticia Escalante.
Leticia Escalante, the Distinguished Direct Patient Care Award. Leticia Escalante has dedicated her practice to supporting and developing her colleagues while also providing exemplary patient care. As a clinical nurse for and charge nurse at City of Hope National Cancer Center in Los Angeles, Leticia created a shift charge nurse orientation checklist. This tool has been invaluable in standardizing the training process and ensuring that all new nurses are equipped with the necessary skills and knowledge to provide high-quality patient care. Leticia also co-chairs her unit-based council, where she drives the council's agenda, plays a key role in decision-making processes, and ensures that all voices are heard and that decisions are made in the best interest of the unit. Leticia embodies the hallmark qualities of direct care nurses, including empathy, resilience, and a commitment to patient safety. Her consistent modeling of these attributes inspires colleagues to pursue excellence similarly. Recognized with City of Hope's Values in Action Award for patient-centered care and collaboration, Leticia epitomizes a distinguished practitioner and a dedicated nursing professional.
Our next awardee is Arlene Lapus.
Arlene Lapus, the Distinguished Direct Patient Care Award. During her more than 25-year career, Arlene Lapus, charge nurse in the Med-Surg unit at the Captain James A. Lovell Federal Healthcare Center in North Chicago, has made notable strides to improve clinical care and inspire colleagues toward professional achievement. As COPD care implementation lead, she managed an interprofessional, evidence-based initiative that decreased the COPD rehospitalization rate from 21% to 5%. A champion of nursing certification, Arlen spearheaded a certification review class in collaboration with certified nurse mentors, leading to a significant increase in certified nurses on the Med-Surg unit. She maintains a recognition wall to create visibility for the center's certified nurses. As co-chair of the center's Nursing Education and Professional Development Council, Arlen coordinates nursing grand rounds, enhancing professional development for her colleagues. Arlen's commitment to care excellence and professional advancement demonstrates her merit for the Distinguished Direct Patient Care Award.
And our final Distinguished Direct Patient Care Award recipient is Janette Richardson.
Janette Richardson, the Distinguished Direct Patient Care Award. As a clinical nurse specialist at Parkview Health in Fort Wayne, Indiana, Janette Richardson has worked diligently to reduce catheter-associated urinary tract infections and improve care for patients with tracheostomies. Determined to see a reduction in cautees, Janette implemented evidence-based urinary catheter bundles, a nurse-driven protocol to remove catheters, and a validated 2-nurse catheter insertion process. When CAUTIs declined but still occurred after these changes, she investigated further, developing a new procedure for urine cultures. These efforts reduced the rate of CAUTIs by 50%. In her daily rounds, Janette focuses on complex patients and assists nurses in understanding the care required. She also provides extensive education for patients being discharged with tracheostomies. This led her to advocate for a tracheostomy clinic. Her efforts have contributed to a 3-day decrease in length of stay and more than $2 million in cost avoidance. These are just 2 examples of Janette's dedication to excellence and her worthy recognition with a Distinguished Direct Patient Care Award.
Our next award, the Early Career Nurse Leader Award, recognizes significant accomplishments and contributions by emerging members of the nursing profession. It is our privilege to honor 2 recipients this year. Our first awardee is Josephine A.
Josephine A., the Early Career Nurse Leader Award. Josephine A. is a highly motivated, aspiring nurse leader with a passion for advocacy and improving access to care. Josephine is a critical care nurse in the cardiothoracic intensive care unit at the Mount Sinai Hospital in New York City. A champion for nursing excellence, she led the transformational leadership team during the hospital's magnet redesignation journey. She co-chairs a professional practice committee and serves on diversity and unit-based councils in the Mount Sinai Health System. Recognized for her potential, she was selected for the Emerging Leaders Program. Josephine contributes to the profession through engagement and leadership in ANA, New York, the Greater New York City Black Nurses Association, and the American Association of Critical Care Nurses, among others. Her commitment to making a global impact led to mission work in Nigeria, providing nursing care and raising funds for clean water and sanitation for vulnerable communities. She serves as an executive board member of the Ghanaian Diaspora Nursing Alliance, a rising star with an impressive array of accomplishments. Josephine exemplifies what it means to be an early career nurse leader.
Our second awardee is Rhea C.
Rhea C., the Early Career Nurse Leader Award. Rhea C., a nurse manager at The Ohio State University Wexner Medical Center in Columbus, has made her mark as a passionate advocate for issues affecting frontline clinicians. Among her achievements, Rhea was instrumental in a collaborative effort that for the first time will bring Ohio healthcare systems together to address violence against healthcare workers. The goal is to reduce violence across all hospitals in the state so that healthcare workers feel safe at work and supported by their organizations. Rhea has been a key member in successful major patient care initiatives at OSU WMC. Her leadership in piloting the Accountable Care Unit model resulted in a reduction in length of stay, improvement in patient and staff satisfaction, and stability of other quality metrics. A founding member of ANA Ohio, Rhea led a social media strategy to build the voice and image of the new organization. Rhea exemplifies the future of nursing and is an ideal recipient of the Early Career Nurse Leadership Award.
Next, the Foundations of Nursing Practice Award, inspired by Jesse M. Scott, recognizes an individual nurse for outstanding accomplishments in nursing research, nursing education, or nursing practice. Our awardee this evening is Dr. Mary Jane Genoino.
Mary Jane Genoino, Foundations of Nursing Practice Award. In a career spanning 30 years, Mary Jane Genoino, an assistant professor at Felician University in New Jersey, has devoted herself to advancing nursing knowledge, fostering inclusivity in the field, and improving patient care. Through her vital research, Dr. Genoino has demonstrated a rigorous commitment to inquiry. Her study on the effects of simulation training on the self-efficacy of nurses caring for patients with COPD and heart failure in post-acute care units exemplifies her research aimed at improving nursing practice. Dr. Genoino is lead investigator in a study to analyze the effects of current global issues on the experiences of Filipino nurses in the diaspora. She lends her talents to nursing organizations, including the New Jersey State Nurses Association, Philippine Nurses Association of New Jersey, and the ANA Innovation Advisory Committee for New Care Models. Beyond research, Dr. Genoino's commitment extends to community support. After losing her husband to COVID-19, she initiated an online support group for nurses who lost loved ones to the virus, demonstrating empathy and providing community during a difficult period. For her leadership and dedication, Dr. Genoino is most deserving of the Foundations of Nursing Practice Award.
The final award in the category for Distinguished Practice in Nursing is the Public Health Service Award. Inspired by Pearl McIver, this award recognizes the exceptional leadership and outstanding professional contributions of a public health nurse in shaping the role and advancing the practice of public health nursing. This award goes to Barbara Russell.
Barbara Russell, the Public Health Service Award. Barbara Russell has been a dedicated and passionate leader in advancing the practice of public health nursing on the state, national, and global level for 5 decades. A member of the Florida Nurses Association Hall of Fame, she is nationally recognized for her expertise in infectious disease prevention and has received numerous accolades for her leadership in HIV care. She has held a variety of leadership roles in the Association for Professionals in Infection Control and Epidemiology and other state and federal HIV and infection control organizations. Barbara has been a frequent lecturer and presenter on issues in public health, such as PPE usage, superbugs, and invisible threats, hand washing, and other proper infection control and public health practices. Today, she continues to serve the public as an infection preventionist with the Florida Department of Health. For her dedication and exceptional impact on the practice of public health nursing, ANA is pleased to honor Barbara with the Public Health Service Award.
And now for our final category of the evening, the awards for Nurse Pioneers, recognizing outstanding contributions to social justice that removes barriers and advance a culture of equity and inclusion in the profession of nursing. The first award in this category is the Luther Christman Award. This award recognizes an individual man in nursing who has made substantial contributions to the profession in areas including, but not limited to, practice, research, education, public policy, and/or community service. We are honoring 2 individuals with this award. Our first recipient is Dr. William Rosa.
William E. Rosa, the Luther Christman Award. Dr. William Rosa is a prolific researcher, lecturer, organizer, and advocate who has advanced multiple national and international initiatives to foster equity and inclusion for all people with serious illnesses. As an assistant attending behavioral scientist at Memorial Sloan Kettering Cancer Center in New York City, Dr. Rosa is the only nurse to hold a full faculty role in the institution's Department of Medicine. In 2020, he founded and remains course director for Memorial Sloan Kettering's annual Palliative Care Scientific Conference, which draws attendees from at least 45 countries, elevating the global discourse on palliative care and pain relief access as a public health priority. Dr. Rosa's extensive published work has been cited to support policy recommendations of major national and international nursing reports. He led a team of 43 authors from 8 countries to develop a consensus paper for the American Academy of Nursing on nursing's role in achieving universal palliative care access. Described as an unstoppable agent of change in the advocacy and policy space, Dr. Rosa exemplifies the ideals and action that marked Luther Christman's profound contributions to the nursing profession.
So unfortunately, Dr. Rosa couldn't be here with us tonight, but we felt it important to share his contributions through the video. Our next recipient is Dr. Nelson Toison.
Nelson Toison, Luther Christman Award. Every step in Dr. Nelson Toison's career has reflected his commitment to the nursing profession with an emphasis on service, education, and advocacy. Dr. Toison is currently the Vice President and Associate Chief Nursing Officer, University Health System in San Antonio, Texas, where he has promoted excellence and exemplary nursing practice. Using the forces of magnetism, he has empowered nurses and created healthy work environments. As an academician and scholar, Dr. Toison has developed and disseminated new knowledge through research and publications. The recipient of prestigious awards for his leadership, mentorship, and service, Dr. Toison has made a significant impact toward the advancement of foreign-educated nurses from the Philippines and other countries. He was instrumental in forming several specialty and minority nursing associations, including the San Antonio Psychiatric Nurses Association and the Philippine Nurses Association of Texas Austin Chapter. He has served on the boards of various professional nursing organizations, including the Texas Nurses Association and the Coalition for Nurse Wellbeing. In honor of Dr. Toison's relentless pursuit of a better world for nurses and patients, ANA is honored to present him with the Luther Christman Award.
The next award in this category is the Mary Mahoney Award. This award recognizes significant contributions by an individual nurse or a group of nurses to integration within the nursing profession. Mary Eliza Mahoney was an impactful leader, innovator, and visionary for both nursing practice and civil rights. She embodied the core values of nursing practice before they were even articulated on paper. She was a light in her generation who proclaimed and fought for diversity and health equity. Tonight's award recipient is Dr. Nancy Atmosphera Walsh. In keeping with this long-standing tradition, ANA will also honor Dr. Atmosphera Walsh with a special medallion as another accolade of this achievement.
Nancy Atmosphera Walsh, the Mary Mahoney Award. Nurse, entrepreneur, and philanthropist Dr. Nancy Atmosphera Walsh has focused her career on advancing the nursing profession to improve healthcare delivery. She is recognized nationally and globally as a voice for nurses and advocate for health equity, especially for immigrants and minorities. The business she founded and leads, Advantage Healthcare Provider Incorporated, provides home and community-based healthcare services and support to intellectually and developmentally disabled individuals in the state of Hawaii. In addition, she has built businesses that provide nurse-led care to vulnerable populations and community-based minority organizations. In 2021, Dr. Atmosphera Walsh made a major financial contribution to the University of Hawaii at Manoa School of Nursing that funded endowed student scholarships, faculty endowed professorships, and an endowed operating fund for the Hawaii State Center. One of her operating endowments supports recruitment and retention of student nurses of color. In recognition, the University of Hawaii renamed the school the Nancy Atmosphere Walsh School of Nursing. Nancy's distinguished leadership and ceaseless generosity of spirit make her an exceptional recipient of the Mary Mahoney Award.
So that brings us to the conclusion of our awards tonight. Congratulations to the honorees. You are an inspiration to all of us in the nursing profession. Now I would like to turn it back over to ANA President Jennifer Mensick Kennedy to send us off.
Thank you, Kalia, and thank you all for joining us this evening. Together with the ANA Board of Directors, I would like to congratulate this year's award recipients. We are grateful for your extraordinary achievements that inspire us all to advance our profession and champion excellence. Thank you for joining us on this wonderful occasion.